It's never too soon to get ahead of hair loss. Hair restoration physicians have scientifically proven methods to stop thinning, slow loss, and even restore your hair. By age 40, many men and women have significant hair loss. Hair restoration can make you look as young as you feel. So the sooner you start, the less you have to lose.
Welcome to this episode of the American Medical Podcast with our host, Dr. Michael Kanosky, a board-certified plastic surgeon, hair restoration specialist, and medical director of AMP Mississippi.
Well, this is the history part. This is what is so interesting to me. People have been fighting hair loss since the beginning of civilization. You know, the ancient Egyptians were the first civilization where we have recorded records of how to treat hair loss. They used to use hippo and crocodile oil. They also used to boil porcupine quills and take that fluid and smear it onto the scalp with the idea that that would take care of hair loss. It probably didn't do anything, but it probably didn't smell very good either. The ancient Greeks used pigeon droppings, for example. That was one of the things that they thought would somehow stimulate hair. The Romans did a little better. They just did the comb over. The Julius Caesar comb forward or comb over, and the laurel leaf, which tried to hide hair loss. Well, there weren't any real advances or changes until the 1700s. It's actually Louis XIII, the King of France in the 1620s through the 1640s. He was the father of the Sun King that everybody talks about. Well, Louis XIV's dad went bald really badly, and he was one of those cavaliers of, kind of 16th century France, and he didn't like that, being the ladies' man. So he decided that he would start wearing a wig. And over time, the wigs got larger and more elaborate, until finally, if you look back in history, by the 1700s, men's wigs were enormous in size with huge curls and so forth. And the reason that they became so popular was because men could cut their hair real short. It was easy to take care of your hair. Remember, people didn't have great hygiene and bathed a lot, and so that was one thing you didn't have to take care of, your hair. Also, remember where you heard about powdering of wigs? That was chalk. And the reason chalk was used to powder the wigs was because it killed off all the bugs and kept the wig nice, fresh, good smelling, and so forth, and people did that. Wigs were extremely expensive, hard to make. They were human hair, sometimes out of animals as well, and it could take, dozens of animals or people from, donating their hair or selling their hair to make a single wig, and they were very expensive. Well, along comes the 19th century, and we have a whole new technology. Suction machines, huge suction cups were put on the scalp to try to suck the hair out of the scalp. That didn't work either. You had all kinds of things from laudanum or opium to try to get hair to grow. Basically all failures. Along comes the last century, around 1950, some real scientific research is done, and people come up for the very first time with some real answers to hair loss. For example, we slowly learned that it was genetics that was the most important factor. If mom and dad are bald, you're going to have the same problem. We also learned that hairs could be transplanted or taken from one part of the scalp, put to another. And finally, we learned different medications that could be used to stop balding in its tracks. So things like spironolactone, which many people in the audience are probably familiar with. It's a drug that we use sometimes for high blood pressure. And in low doses, we still use it today for people to stop their balding. But there are numerous medications now on the market, as well as other types of treatments to either stop balding or to regrow hair. So next slide, please. Let's talk a little bit about the science of today's hair transplant and hair regrowth. Regrowth is a little bit different than hair transplant. Regrowth is where we take the hair that's thin, wispy, basically dying. The hair follicles are slowly going away and reinvigorating those hair follicles. We can do that with infrared light therapy, PRP, which is platelet-rich plasma. We can use this with different topical medications, including copper peptides and other medications that we'll talk a little bit about. And of course, various types of transplantation techniques as well. And finally, the most recent thing is hormone therapy, which we're now using to help stimulate hair growth. Okay? The whole purpose of all of the restoration and restorative treatments is the idea that we get the thin, wispy little hair follicle on the left side, whether it's laser therapy or any of the other treatments, to grow thicker, bigger, and heavier like you have on the right side of the screen. And so all of these goals are to get your hair thicker and heavier, probably the way it was years ago, and that you just have lost a little bit. Next one. Okay, let's talk about each and every one of these. Infrared light therapy. Infrared light is where you sit under infrared light lamps. You're able to stimulate the hair follicles. It increases the blood supply and blood flow to the scalp, and especially to the hair follicles. It ramps up and increases the energy that the follicles are making, and the amount of energy increases, the blood flow increases, and voila, they're making more hair. They're making more keratin, which is that protein we talked about, so the hairs come out bigger, fuller, and thicker. Next one. Let's take a look at a patient. 3 slides. This is before he had any infrared light therapy treatment. As you notice, this gentleman is very thin on top, but he still has his hair follicles, or the roots of the hair, that are still available and still there. They're very fine, very wispy. Look how this gentleman succeeds after about 6 weeks of therapy in the middle, and then 18 weeks, which is our usual period of time that we wait after these treatments. And the idea is that this can truly stimulate and regrow the hair before it shuts down completely. So infrared light therapy is a great option for a lot of guys, a lot of ladies, before you've lost your hair completely. There are a lot of over-the-counter lights that you can purchase, but frankly, most of them, they don't do you any harm, but they're not doing a whole lot of good either. Visible light, what we actually see, is divided up into various spectrums, and there are different lights that we can barely see or only appear as one color. The red spectrum is one of those. Infrared means the near red, close to red, but it's a little bit different frequency. These wavelengths, which are available in very, very low doses in the sun, are concentrated in these machines. And what they do is they stimulate the cells to produce more energy, as well as increase the activity of the cells in the hair follicle. It's a very successful treatment. Now, here's the interesting thing. Light energy of different wavelengths means different color. Different wavelengths can do different things. Now, there are some harmful wavelengths. Ultraviolet, for example. Many people have read about or heard about ultraviolet. Get a little bit of ultraviolet and you get tan. Get a lot of ultraviolet and you get skin cancer. Well, this is a very different wavelength. This doesn't cause any skin cancer. This happens to be one of those wavelengths that stimulates your skin and does a great deal of good for your skin, producing more collagen and elastin, producing healthier, more vibrant skin, and really stimulates the hair follicles to grow. So infrared is a very, very helpful technique. It's a mainstay, and we use it on a lot of patients. But here's the kicker. What you buy at home, okay, for $999 or thereabouts, is a very low dose machine. Once again, it may not be true infrared, it may be true red light, in which case it does very little or nothing. But because it's so very low in its energy, I tell patients it's like trying to warm a room up with a flashlight. It's not going to work. Now, it's not going to harm anybody, but the fact is that if you really want hair to be stimulated to grow, you need a much higher energy source. This, what we have in our office, is that high energy source. And it is a very expensive machine, but the idea behind it is it gives you a very high wattage of this infrared light that can penetrate through the upper layers of skin down to the hair follicles where you need it. If you don't have something like this at home, you're not going to make a lot of progress. As I said, it's not going to harm you what you buy over the counter, but Just like anything else that you can buy over the counter, it's certainly not as strong or as effective as those things that you can get by prescription or by going to your doctor's office. You better believe it. Infrared is good for skin overall. Infrared light has been shown, along with some other wavelengths such as green light and so forth, to really help stimulate collagen production. Collagen is what's in our skin. There are two basic proteins in our skin, collagen and elastin. Collagen makes it thick and heavy, and it's the reason why our skin is so tight when we're young. We've got lots of it. As we age, we get a lot less, so our skin becomes very loose, lax, and sags. And things can stimulate collagen production, and this is one of them. I might add there's one other very interesting fact, and that is infrared is antibacterial and antiviral. Infrared light can be used as a treatment for acne as well, because it helps kill germs and some viruses. It's not necessarily as good as an antibacterial, such as an antibiotic if you have an infection, but for our skin, it really does help the skin look a little bit more vibrant, a little bit better, and grows your hair back as well. So get all of those good pluses from it. And frankly, so the infrared light can not only help grow your hair back if it's getting thin, but can also decrease and fix some of those wrinkles. And if that's not enough, we can always throw a little Botox in for you as well. So we can take care of those wrinkles for you as well. Having said that, next slide. The next mainstay that we use is PRP, platelet-rich plasma. Platelet-rich plasma is a simple process where we actually draw your own blood, a blood sample, take that blood, we centrifuge it and prepare it with some chemicals and draw off that part that's called the platelet-rich part. Platelets, if you may remember, is that part of our blood that causes some clotting. But inside the blood platelets are growth factors, and those growth factors have been shown to greatly stimulate and do a lot of good for different tissues in our body, particularly in the hair area. We harvest that platelet-rich plasma, which is a portion of your blood, and then use it to inject into the scalp. Let's go to our next slide, please. And the platelet-rich plasma injection is where you see a small, wimpy hair that is being injected, and what you see over the next several pictures is a hair follicle that's being stimulated after the injection. PRP does a number of very important things. It blocks DHT, dihydrotestosterone, the culprit for hair loss in a lot of guys. It increases the number of blood vessels that go to hair, and it also increases the oxygenation, or the amount of oxygen that gets to hair follicles. So it's a strong and very positive thing. We use it a lot, and it's been very successful in our practice to re-stimulate hair follicles. Next slide. Okay, now let's show some PRP before and after pictures. The first gentleman we have is before and after PRP. This is before he had any injections, and this is about 9 months to after. You have a series of 3 injections to the area, and then it takes between 6 to 9 months for the hair follicles to grow. Remember, hair grows 2 sheets of paper thickness a day, so it takes a while. But this guy's hair not only came back, but it's thicker and heavier than it used to be. And it's not painful, there's some mild discomfort, and the patient's able to regrow their hair. And of course, this is permanent. This is not something that he'll need to continue treatments forever. I usually do recommend 1 PRP treatment a year after this, just to keep the cells, the hair follicle cells, invigorated so that we don't backslide. Next slide. And this is a lady, same problem. Hers is kind of diffuse, wide part. This is where she too has had a series of 3 injections, waited a few months, and now you can see on the right side of the picture where she has got much, much thicker, fuller hair. And I tell all my patients, hair restoration takes a while. If somebody promises you instantaneous results, I would tell you that they're going to take your money, but you're not going to probably end up seeing the results that you want. Nothing is instantaneous, and if it sounds too good to be true, it probably is. So I tell my patients to be patient. One thing I do to address and help you see the progress that you make is that when you come to our office, you'll have multiple pictures taken. And that'll be every time you come in. And we also take hair counts. And the idea behind that is we're able to tell how thick the hairs are, how many you're growing, what they look like. And so we can use an objective way to tell that you're doing, that you're getting better and that your hair is thickening and growing. And we feel strongly that alone is a good reason for you to come in to see a specialist. We're certainly available, and the idea is we'll get to the bottom of it much quicker rather than trying home remedies, shampoos, creams, powders, and so forth that are often unproven.
To hear more episodes of the American Medical Podcast with Dr. Kanosky and his medical and wellness guests, follow us online. American Medical Podcasts, amplifying health and wellness.